to remember is the names of each of the teeth, which I talked about yesterday, and a little bit, what their jobs are. But I wanted to talk also about the formulas. So the two that you need to know the formula, kind of like when we did the vertebral column and you had to put like C7, T13. This is how we do the dental formulas. What is interesting is the canine adult. So the I here represents incisor. And then you have almost like a fraction, 3/3. 3 is how many they have on the top. The top number is the top and the bottom is the bottom. So a canine has 3 incisors on the top, 3 on the bottom, 1 canine on top, 1 on the bottom, 4 premolars on top, 4 on the bottom, 2 molars on top, but 3 on the bottom. If you add that up, that's 3, 6, 7, 8, 12, 16, 18, 21. So there's 21 teeth, but it says 42 teeth. Does anyone know why that is? Anyone? Bueller? Oh, there's messages. Here we go, popping in. 2 sides. Yep, it's half. Exactly. So this dental formula represents 1/2 of the mouth. So it's basically every number is doubled. So they have 3 on the top right, 3 on the top left, 3 on the bottom right, 3 on the bottom left for the canine adult. So now, if we go down to the cow or the bovine here, you'll see it has I, 0, and 3 on the bottom. And then you see the rest of the numbers and no canines on the top. Does anybody know what a cow has that's different than all these other species? Or I should say a ruminant. They have something, it's kind of, well, it is, you're not too off base. It's called a dental pad. Let me see. Oh, it won't let me. Okay, I was trying to, oh, there we go. Let me try and show you a picture of this because I usually bring it in class. I have a skull of a cow and you can see the difference, but and oh, this is a good one. I don't know if you can see that right here, but here's the bottom teeth. Oh, here's a good one right here. I don't know if this is, you guys can see this okay. But here is, it's a dental pad. You can literally run your thumb in their mouth and open up their mouth if you need to. And what they do right here is they will grind feed along their dental pad. So that kind of helps them grind. And it helps them, digest their food because they're going to kind of rub or translate against that jaw. Now you can see here, there's the teeth, the premolars, the molars, and then I've just got this flat pad. So right there. So that's the dental pad I was talking about. Okay. Okay, I lost my chat. There we go. Okay, so it's called a dental pad. So on a test, I want you to be able to write out the formula like it is. If I ask what is the formula, and also know what each letter stands for. I, incisor, C, canine, P is premolar, and M is molar. Okay, so if anyone has questions, now you do not need to know this. I'm not quizzing you on this, but this is what you'll do in dentistry. It's called a Trident system. Every tooth has a number. Okay. And a lot of clinics now, in my day, we literally just kind of wrote, I would write canine upper right is fractured or cavity seen in the lower left premolar. But a lot of clinics that are advanced are using a dental charting. And usually the technician does the initial exam and does the initial charting, and then the veterinarian will come do their exam. So you will learn this when you do dentistry, this Trident system. Now, the tongue, which is part of the oral cavity, is muscular. It does have 3 parts, but it has mechanical function because for grooming, and then it will move food into the pharynx, which is the throat. Now, the grooming portion of that, if you've ever had a cat lick you or felt a cat tongue and they have like those hooks or barbs, so they, but any animal that has the little papilla on the tongue, that is able to assist with grooming. But it also has taste, sensation, temperature, touch, and it helps with thermoregulation with panting. So the tongue, you can also notice sometimes on dogs on a hot day, sometimes their tongue looks bigger. I mean, it's kind of engorging with blood and opening up and trying to relieve heat. So that is part of the job of the tongue. Now, one thing just because it talks about panting in dogs here, I want to mention, panting is normal in dogs and can sometimes be they're hot or they're excited. Panting in a cat is never really normal. It can be stress. I've seen cats that when the owner brings them to the vet and they're in the carrier and they're panting, sometimes we take them in the back, let them calm down. But cats don't really pant to relieve temperature like dogs do. I mean, I have seen it be a July day and an owner comes in and maybe they had their windows up and their car was hot, but it's not normal for a cat to walk around panting because they're excited or this. So panting in a cat is usually stress or sometimes respiratory distress. But in a dog, panting is typically a lot of times happy reaction, this and that. Now, saliva, I become a stickler on the test because people tell me, if I say, where is saliva produced? And they say, in the oral cavity. It's produced in the salivary glands. It's deposited in the oral cavity via a duct. So the salivary glands are, and they're in similar locations in people. We have a gland right here, kind of embedded. It's below your jawline, kind of up near your ear, right about here, called the parotid gland. I don't know if you've ever, you see your food coming, you're really hungry, or sometimes you take a bite of something that's very sweet or very salty, and you might get a sharp pain right here. You're getting a constriction of your salivary gland or your parotid gland. And sometimes, and mine bug me sometimes, and I end up like kind of doing this because I can just feel that they get tight. And people sometimes get stones here and they can get swellings and they get blocked. Dogs can get this as well, but they are here. And then there is a tube or a duct that takes the saliva from the gland and then deposits it in the mouth. Obviously, we know production varies on species. The cow probably produces about the most saliva. That is due to what they eat. The way they eat the grains and the grasses, and they have to have it go to the rumen and have it basically helps lubricate it, helps begin the digestion process. If you own a bloodhound, a mastiff, some of these guys produce a lot of saliva. So production based on species, it should be watery to viscous. Now remember, viscous is sticky. So some dogs, I mean, the saliva is very just drippy, and some they get that ropey, sticky drool, which is actually saliva. It does have a component of water. I do want you to be able to tell me some components of saliva: water, protein, antibodies, electrolytes. This is an important one to know, salivary bicarbonate, because I want you to know bicarb is a buffer. Bicarbonate is a buffer. We can give bicarbonate via injection. My grandma used to get this citrocarbonate. She says, I'm going to get some citro. And I think it was like an Alka-Seltzer. She'd put it in a cup if you weren't feeling good, and it would fizz. Basically, what it was doing, it was kind of bicarbonating or buffering stomach acid. Okay. Bicarb, if the animal ingests something that's acidic or potentially, they are trying to buffer it before it gets to the stomach or for digestion. So the bicarb is going to act as that buffer. And then I do want you to know there's some enzymes. The main one, there's lysozyme and amylase. Now, if anybody, I know some of you work in practices, and if you've looked at blood work, one of the tests we do for the pancreas is we test for amylase. If a dog has an elevated amylase or a lipase, we are highly suspicious of pancreatitis. Now, when we do blood work, we are measuring amylase concentration, and that has to do with the pancreas. We're not really measuring amylase in the mouth. Okay, so the amount that's in the mouth is negligible. When we worry about the pancreas, we're worried about amylase in the blood, elevations. If we have too much amylase in the blood, it's a sign of pancreatitis. So, but it already starts digestion of carbohydrates. So these are the functions of saliva that you need to know. So this is slide 20. Slide 20, you need to know the functions of saliva. Obviously, to lubricate has some antibacterial function. It will help regulate pH. That's the acidic. That's what the bicarb does. If we have an acidic pH, an acidic food, the bicarb in the saliva helps buffer that and alter the pH. Thermoregulation and enzymatic digestion. Now, the three main ones, I know you guys go over salivary glands because you talk, I think, about a zygomatic one. There's different salivary glands. The three primaries that I would want you to know is the parotid, mandibular, which would be right about here. So here's your mandible, okay? We've got parotid, mandibular, and obviously sublingual is under the tongue. Now, let me skip ahead a few slides. Here's kind of where they're at. So you got these salivary glands. They will, via duct, take the saliva to the oral cavity. Now, I'm going to talk about this in a little bit, but if you've ever heard of Pavlov's dog and, conditioned responses, and maybe you talked about this, I will tell you, like every morning, let me go back. Every morning, I give my cats it's like a little tray. I crack them in half, a little canned food, because my dying cat, I started giving her canned food to treat her, fatten her up. When Bo hears me crack that dish, he comes running because he knows I let him lick the little tray. It's like our little morning routine. So I'm like, here, you can go, you can lick it. While he's sitting there waiting for me, here comes the drool. He's not a big drooler, but as soon as he's waiting, it's the anticipation of, I get to lick the cat dish, and then I get the drool. So normally saliva, and I'm going to talk about secretion of digestive enzymes, saliva, and whatnot. Sometimes the anticipation of a meal is going to get saliva being secreted. If you've ever, I'm sure people, it's like you're hungry, you see your pizza coming, you're like, that's my pizza. And you feel, sometimes people can feel either the squeeze of this, they get like a pain here, or you just feel like the saliva enters your mouth. So it's an anticipation of eating. Now, I talk about digestive tests later, and the fact that we cannot do these tests near our kitchen in the clinic because we don't want digestive. Sometimes we want to do blood work before they've had a meal. We don't want any digestive functions being secreted or beginning. So because we know sometimes if a dog just hears a can opener, smells food, hears the crinkle of a bag, they know that it's coming, and then we start those digestive Oh yeah, they know. My cats, when I make sandwiches, they hear the crinkle of the little lunch meat bag, they come running because they know I always, as I make a sandwich, I drop a little piece of like turkey or ham. I just give them a little piece. And so now this has become a thing. They hear that. They hear, my Bo hears the little crack of the cat thing or the pop of a can lid. Yeah. So it begins that whole process. That becomes important later because we talk about secretion of those enzymes. Now, the TMJ joint, temporomandibular joint, temporal bone, mandibular bone. If you remember, the mandible translates with the temporal bone right under the zygomatic arch, okay? And this is where the jaw, the hinge, think about a door hinge where your door opens and closes. If your door was a jaw and where that hinge is, it's the condylar process of the mandible. Remember the condyle, it's on the edge, and the mandibular fossa, because that's where the mandible sits. Most species, the primary is extension and flexion, open, close, extension and flexion. But certain species are going to translate their jaw. Translation is that, like, now you can, every time I go to do this in class, I was like, I don't want to pop, but if you move your jaw back and forth, we can translate. That side to side is translation. But if you watch a cow eat, okay, she's sitting there in a field and she's eating, they have a higher degree of translation because of their dietary preference. They can't just up and down on grasses, okay? If they just chew up and down, nothing's happening. They have to grind the grain and grind the grasses that they are eating, okay? So depending on what they eat goes back to how does their jaw move. The species, it's going to depend on, what they're eating back and forth. Okay. Now I've told you pharynx food first. The pharynx is the throat. It's the common passageway for the digestive structures and the airway structures. So it has both parts. On the test, and since I kind of didn't mention that at the beginning of class, on your test, what I've tried to do now for every test is if it's an essay, if it's a false, sometimes if it's like a fill in the blank, there's a spot where I can put the answers. So when you guys had to diagram that picture of the head, I asked, there was a questions 1, 2, 3. After you labeled structures, it was 1, 2, 3. Number 1 was the nasopharynx, because the soft palate splits the nasopharynx from the oropharynx. So, wait, what? Oh, hang on 1 second. Hang on. Okay, sorry, he had to run out for a second, and so I'm on puppy duty, I guess. So on that test, I was looking for oropharynx and nasopharynx. The pharynx is the general term, but it is split into oro and nasal. And that's what I was looking for on the test. And again, a side note, you should be able to see the answers and what you got wrong. as far as blood flow, as far as like, any of the other fill in the blank. And sometimes I type my own feedback to your test. So that's why I've said everyone should probably go back in and look at the tests and see what you got wrong, or, see your feedback. And I always want you to check your test in case I made an error. So hopefully you can see the key, add up your points, contact me if there was an error. The other structures that are in the pharynx that I didn't talk about last week is the eustachian tube and the tonsils. Now, we don't deal with tonsil issues like, people have a lot of tonsillitis and issues with their tonsils. Dogs have tonsils. It's an immune structure, but don't tend to have problems. Now, the eustachian tube is basically the connection of your inner ear, your middle and inner ear, to the back of your throat. If you've ever flown, or you drive up a hill or you drive down a hill, and sometimes you feel that pressure and you yawn, or they say chew gum, because basically it's an air-filled tube. And what you're trying to do by moving your jaw and stretching is you're trying to change the pressure and relieve the air that's being trapped in that tube. So the yawning or the chewing is changing the position of the eustachian tube into the back of your throat. And if people have a very bad inner ear infection or such, it can drain into the back of the pharynx. So there is a communication to that tube, to the pharynx. Now, the esophagus is a muscular tube, and that is the connection from the pharynx to the stomach. So it goes through the neck, it's going to go through the thorax, through the diaphragm, and into the stomach. So there is the esophagus has to pass through the diaphragm, so do blood vessels. But the diaphragm is sealed around that. It's not like there's a hole, because remember, we want to keep the chest cavity, we want to maintain that negative pressure. So there is a seal. The diaphragm would be right here, okay, on the picture. It'd be right along that liver and stomach. It is a folded mucosa, and it does have muscular contractions called peristalsis. So when we get into peristalsis, I talk about peristalsis in the intestine. We also have peristalsis in the esophagus. And again, there are two, I explain this there's two layers of muscle. Longitudinal is going to move things long ways. Circular muscles are going to have an up and down or segmentation. So that is how food is moved down through the esophagus. Now, some dogs can get a genetic condition called megaesophagus. Sometimes there's a band of tissue here and it constricts the esophagus. It can be traumatic. Megaesophagus, German Shepherds are one dog that can be prone to it genetically. But what happens is their esophagus gets very large and very dilated. And then what happens is these dogs eat a meal, they bend down and eat. And as soon as they bend down again, sometimes the owners are like, they're vomiting all the time. But this is not an active, like, where you know vomiting's coming. This would be like they just put their head down and stuff came out. So it's more of a passive, like, regurgitation. But what's happening is the food they ate is sitting in this big dilated esophagus, and it doesn't have the muscular ability to contract, so food sits there. So if you've ever seen, there's pictures of these online, there's cute videos. There's a thing called the baker's chair, where the dog sits in a chair, almost like a high chair, and the owner can feed them or they can eat, but they have to be propped up. So a dog can live with megaesophagus. It takes a lot of care from an owner to be able to take care of them, because they have to be fed usually a blended diet. Usually it's, usually it's a blended diet, or meatballs, like one at a time. They can't eat fast. Usually feeding them takes at least a half an hour. Or I've told people, if you can get your dog to put his paws on the counter and he's standing and you feed him like that. But a lot of these dogs that get it as puppies can be trained where they literally walk into the chair and sit down because they know food's coming. So if you do not have muscular function, that will not work properly. Now, the phases of eating, and I do want you to know what these words mean. Prehension is the actual grasping of food. So when they grasp the food, chewing is mastication. So when they start to chew the food, they do that. As soon as they grab the food and start chewing, then they're typically going to start secreting saliva. And this is what I just talked about. Salivary secretion is regulated by the nervous system. That is an autonomic response, okay? Because remember, I said they don't actually, I can't go, hey, I should salivate right now. It's autonomic, so it's nervous influences. And this was the triggered responses. Hearing the crinkle of a bag, the can opener, the cracking, whatever. So then salivary secretions happen. After the food is chewed properly, saliva, then they're actually going to begin swallowing, which is deglutition. So deglutition is the act of swallowing. Now that is voluntary, okay? It is voluntary when it is in the pharyngeal stage, which means, well, let's take us for example. If you eat a piece of steak and sometimes it's tough and you're chewing and chewing and chewing, you decide when the food is good enough to swallow, just like a dog. And we all know that there's some dogs that just inhale food. I'm like, did you even chew that? But there is the ability to decide when to swallow. Once it enters the esophagus, once it goes out of the pharyngeal stage to the esophagus, then it's all autonomic again. Then that's going to begin peristalsis. Peristalsis is this wave motion, okay? So here is what I was talking about. You're going to get contraction and you're going to get movement, but it is a wave-like motion. And as soon as I think you probably learned this in nutrition, but as soon as it starts moving in the intestine, in the esophagus, it should continue. There's always a continuous movement or a continuous peristalsis. It's always good to have GI movement. The way I think of it is autonomic. Like I think I talked about this when I did the nervous system. If you feel like your stomach's about to growl and you don't want it to, and it's kind of embarrassing, but it happens anyway. Like you're going to feel it coming, but you can't really stop it. That's that autonomic movement of the GI tract. And then when you get food in, it's called a bolus. So at this point, chunks of food that are moving through to the intestine are called a bolus from the esophagus to the stomach. But it should always be peristalsis. Always, always, always. Now, it's 9:01. I want to mention something since I'm getting ready to talk about the mesentery. And this is basically, you're not going to label this picture. Don't worry. Basically, this is the layers. Remember when I showed the picture of I said the intestine was cut in half, and then you have mesentery, and here's the mucosa, which is the inner part, and it has these folds, okay, right here. Then you have the muscular layer, where it's right here, submucosa. The outside is the serosa. And then I said, here's the blood vessels coming in through the mesentery. Now, let me back up and mention something about the test. If you talked about the blood flow on the test, I've given you that handout that shows the proper blood flow. So I did not write a bunch of individual things. And for the most part, they were fine. What we're adding for this test is there's going to be blood flow on this test. Do you remember when I say aorta and then it goes to an artery? Instead of saying artery, this is going to say mesenteric artery. Okay? Because after it leaves the artery, it's going to go to the mesenteric artery, mesenteric arterial, mesenteric capillary, and it's going to give the intestines oxygen and pick up CO2. Then it goes to mesenteric venule, mesenteric vein, and then the vena cava. Do you see how I've added the intestine is the body part? Okay. On the test, that was worth 6 points. And I think most people got it. Some people mixed up, maybe put vein before venule, but you know it goes big to little, little to big. So it can't go to the vein and then a venule. That's, you know, backwards. Or if you put the O2 for CO2 wrong, you know, it was flipped. Whenever it's leaving the aorta, O2 goes first. When it is going to the lungs, CO2 is being given first. So whatever is first in that O2 for CO2, that means the oxygen is being dropped off, CO2 is being picked up. So that on the test, you know, and I gave the suggestions to maybe write those parts on note cards, sticky notes, write every, you know, you have the handout, write every name of every part on a card, and then see if you can put them in order, and then look back to my handout and see if you did it right. I think that's one of the easiest ways. You can write it over and over and over again, and maybe that helps you. But you want to have some way to know you're putting it in the right order. So for this test, we're still doing the blood flow, but instead of, like I said, it would be like mesenteric artery, mesenteric arterial, because it is bringing blood supply here to the intestine. Now, if you remember the abdominal cavity, so when I say cavity, thoracic cavity, let me mention this. When we reviewed the last day, and I think I had everybody in the review. I don't know if everybody always stays on and listens to me while I'm talking. Some people might say I'm here and then go make breakfast or study for something else, whatever. I was clear that when I talked about what is in the thoracic cavity, I did not want, you know, the ribs. I did not want the diaphragm. I did not want, you know, things like that. I said, those are like walls. If I say, what is in your bedroom? What do you have in your bedroom? You're not going to say, well, I have a wall, I have a window. You might say, I have a bed, I have a dresser, I have a chair, I have a TV, I have a computer. Those are individual things in your bedroom, okay? The walls are enclosing it. If you put mediastinum is a space. It's not a structure of the thoracic cavity. It's a location within the thoracic cavity. So I don't know if people didn't hear that part or didn't remember it when I talked about it in the review, but I said, and when I go back and look at the test, and then I go back and remember what I said in the review, if you listen to my review, pretty much I was like, if I say this, I don't want to see this, knowing whether there's more oxygen coming here, more oxygen coming there. So, you know, the review for the homework and the review that I recorded was pretty much like, you better know this, you better know this, you better know this. So hopefully you got that part. So I would go back and look and see what you put for thoracic cavity. I would go back and look at your blood flow. and see where, like I said, it was hard for me when I'm grading that to put everywhere, but you have the handout. So you can literally look at the handout where I wrote it out and look at your test and, oh, that's where I mixed it up, or, oh, that's what I put. And since I'm on that point, does anybody have a question about the test, or was something confusing, or does somebody want to add something, or ask me what the heck I was talking about? The other thing that was where people got kind of confused was a little confused about where the body went and where the lungs went. Or are you talking about in the blood flow, Sean? Like, yes. So whenever it leaves the aorta, it's going to somewhere in the body, but the lungs are separate. I know the lungs are part of the body, but the lungs are pulmonary circulation. So whenever it leaves the aorta, it's going anywhere except the lungs. The pinky toe, the kidney, the liver, the eyeball, the brain, the tail. You see, when it comes back through the vena cava, goes to the lungs, then goes to the vena cava to the heart, then it's going to go to the lungs. So the lungs are pulmonary circulation. So when it leaves the aorta, aorta will actually, yes, and Teresa, in that, you don't almost have to put body. You can put aorta. Well, yeah, I mean, body, artery, arterial, exactly. Yep. And then you're going to put, after that, you put venial, vein, vena cava, right atrium, tricuspid, right ventricle, pulmonary artery, pulmonary, and yet after pulmonary artery, you can put lungs. I think I did put that feedback. After pulmonary artery, the lungs aren't before the pulmonary artery, because the pulmonary artery is leaving the heart, then it goes to the lungs, and then it branches. So does that make sense, Sean and Teresa? And Teresa, yeah, Teresa, you're on point with that. Okay. So, and the reason I want to review it is, like I said, it's going to be on this test again. So, and I have done it in the past where I haven't done a word bank. People just need to do that from memory. So I've gotten maybe a little bit kinder in my old age and given you a word bank. This next test, I might give you a partial word bank, because now we've done it 3 times. So I feel like some of this should be starting to become second nature. So, so I would just say, go back through that test. They should be open. I usually keep them open for you to review. And then obviously when it comes to the midterm, they will be open so that you can review it. And then this material will be new, so there won't be a test to review for this. Okay.
I have one more question.
Sure.
So on the test, when we were labeling the diagram where we were labeling all the stuff in the mouth,
Yeah.
You said that one was nasopharynx. What was 2? I marked both of those as our meatus stuff.
Oh, the meatus. Oh, yeah, I'm glad you said that, because I did get a lot of nasal meatus. One was nasopharynx, because that's the space above the soft palate. Below or ventral to that is the oropharynx.
Okay.
Oropharynx. Now, the nasal meatus is the opening at the nares, where, there's a dorsal, middle, and ventral. And so the ventral nasal meatus was the one I wanted people to know, because that's a landmark when we pass those feeding tubes and such. Because if you do go through the ventral meatus, you can pass to the back of the pharynx and then down into the esophagus. Now, I will bring up something else. I've already lost a couple people online. It looks like some people have dropped out, maybe Wi-Fi, whatever. There is a concern from teachers in general during Zoom that people log in and then go away, mute, do whatever, because sometimes we ask questions and it's like a ghost town, or I've got the same people answering me. So we can go in and see how people are logged on. We can go in and see how long people were present for the class. I've been pretty like, you log in, I mark you here. And I've not been like a stickler, but I know, you know, Neemer's been looking at that pretty close. Gillis has been having issues in her class. I know that Sipes really can't do Zoom because of where she's at. So my whole thing is, there's a lot I'm trying to give during this lecture. I can't force you to listen to me. I'm going to talk. I really hope that you're there and present. And if you took the time to listen to my review for the respiratory test, I almost gave you the test verbally. So there was a lot of stuff I said that should have helped you on that test. So just be aware, you know, that's some things that are being monitored. So. Oh yeah, and I think, yes, you can see how many people are viewing on YouTube. I think some people, I mean, I'm going to keep posting my videos. I'm not getting really a ton of views. Some of my videos that I record for lecture, I don't almost have any views, but I'm like, I'm going to record it and throw it up there. So, you know, I can at least, I'm trying to do everything to give you as much normal class as possible and as much normal lecture so you have everything you need. So, and I know people have Wi-Fi issues, so, but it's just communication. If you have Wi-Fi, people communicate and let me know. Sorry, somebody woke up and I thought would sleep the whole time. Not sorry, but this is your Friday telling you to have a good weekend. If you don't have any other questions, I will record this. Sorry, I went off on the test tangent, but I realized, like me, I probably should have talked about a few things. So we'll stop here. I will send an email later with this video and the homework. We don't have class on Monday, so we'll just plan on meeting Tuesday at, yes, crazy puppy. My husband is out of town this weekend. Friday, he leaves tonight, and he's back Sunday afternoon because he has to help his brother in Chicago. So it's me, my daughter, and the puppy. He's taken Bo with because my nephews love, they can't really have a dog, so when we bring them, it's like their dog time, which gives some good puppy bonding, but I don't know how much I'm sleeping this weekend. So AJ says, have a good weekend, and it was good to meet everybody. You could say bye, AJ. You could say bye, AJ. You could say bye. You guys have a good weekend. AJ says, happy Memorial Day and stay safe. Better get somebody out to potty. All right, I will see you guys later. You too have a, okay, hang on, AJ. All right, we'll see you guys.